For any medication or new treatment to receive approval, first of all, its efficacy needs to be proven. The best method for proving efficacy is considered to be a randomized controlled trial or a RCT. A randomized controlled trial consists of two groups. One is the intervention group, the other is the comparator group. While the intervention group receives the medication being trialed or tested, the comparator group does not. After a period of time, outcomes in both groups are measured and compared. If the intervention group has performed significantly better in terms of outcomes, the efficacy of the new medication is considered as established. Nowadays, however, trials are getting more and more complex. They do not involve simply a medication, but may also involve, in addition, an exercise coaching program or a coaching program to teach skills, for instance, cooking skills. They may involve use of a digital device that can track medication adherence among patients, or a mobile phone application that improves patients' understanding of their own condition, thereby helping them to manage their disease better and also improve communication with healthcare professionals. For instance, on the slide here, you see a screenshot of a mobile health application that was intended to help patients with atopic dermatitis manage their conditions better. They can take pictures, upload it, and communicate with their doctors about how their skin is doing. And similarly, you also see a screenshot of one of the papers that was published about combining electronic website that coaches patients to self-manage their hypertension better, along with teaching kitchens that was focused on teaching them cooking skills. And full disclosure, one of the authors of that paper is me. Now, a problem with such complex trials is that because of their multi-component aspect, sponsors may not agree to funding such trials right away. And in that situation, one of the solutions is to first conduct a feasibility trial. The goal of a feasibility trial is to see if such a complex multi-component trial is actually doable in the real world setting in terms of both finances as well as operationality. The study design of any study is determined by its purpose. Similarly, in a feasibility trial, the goal is not to prove the efficacy of the treatment right away. The goal is to check if the trial is doable in the first place. As I said, feasibility, operationally as well as financially. So a major difference in feasibility trials and randomized controlled trials is that every participant in a feasibility trial will receive the intervention. There is no comparator group because efficacy is not what we are out to prove. We are out to study if we can do this, if this is feasible at all. Secondly, in a feasibility trial, the sample size is much smaller than a RCT. There are multiple guidelines for assessing a feasibility trial, the multiple aspects that a feasibility trial must test. It should test if the intervention can be carried out in that particular setting, if it will be acceptable to the users, and if the intervention implementation itself is feasible or not. Can the data be safely collected? So there are multiple aspects to a feasibility trial. As trials are getting more and more complex and operate out of multiple sites and multiple countries, those standard trials can also be preceded by a feasibility study sometimes. So here's the final conclusion. The feasibility trial is often the first step of evidence generation as trials have become more and more complex. The second step would be phases of a randomized controlled trial. Thus, a successful feasibility trial can often pave the way for the execution of a randomized controlled trial. And evidence generation thus includes both demonstration of feasibility by way of a feasibility trial and demonstration of efficacy and generalizability of those results by way of a randomized controlled trial. It helps to keep in mind that the purpose of any research is to impact policy and practice. When we are able to generate evidence, solid evidence of efficacy, feasibility on the basis of both feasibility trials and eventually randomized controlled trials, We may be able to convince third party payers like Medicare and private insurance companies to pay for these multi component complex intervention approaches.